We're going to do another routine adjustment here with Sean, our videographer. First thing, as always, I want to take a look at is our leg length. Leg length is determined by our pelvic equality, and when we have a pelvic inequality, that's when one leg gives the appearance of being longer than the other. So left leg is short, which typically means that glute med and or piriformis will be tender. So that little cringe and sigh from Sean means that piriformis and glute are awfully tight today. So first thing I'm going to start with is a little bit of stretching. I like to see how mobile the ribs are. I'll do a little bit of long axis here. Sean is awfully tight from working hard behind the computer. And we're going to do our 3 drops on the left upper SI joint. Now we're going to do the lower on the right. Is that tender at all when I push in? Okay. So Sean's sacrum has too high of an angle. So what we're going to be doing is counter nutation. So Sean, I'm going to have you take a big deep breath for me. We're going to hold it. We're going to exhale. Good. Again, big deep breath. Hold it. Exhale. And last one, big deep breath. Hold it. And exhale. Good. Feeling in here. It is usually ticklish for Sean, but we know we got to work on this L2 and L3. So I'm going to have you take a big deep breath for me. All the way out. And again, big deep breath. All the way out. For this L1, I'm going to have you take one more big deep breath. And all the way out. Come back here. His legs are indeed back to being even. Pants are nice and crisp. So, Mr. Sean, I'm going to have you go onto your back for me. And we're going to progress into our supine thoracic mobilization. Sean, I'm going to have you bend the knees for me. We're going to do feet flat on the table. In order to adjust this area, I'm going to have you interlock your fingers. You're going to place them behind the neck. Have you take a big deep breath here. Hold it. Exhale. And again, big deep breath. All the way out. And last one. Let your chest fall back. Beautiful. So there we're focusing on T4 through T7, and then we also did T10 and T11. We're doing a flexion-based adjustment there in order to create more of a kyphosis in his thoracic spine. For Sean, Sean has a very straight neck. He's a very frequent office worker almost every day, between that, video games, and videography. So one of the big things we have to do is put a little bit of extension into the center part of his neck around C5. Now on the right side, this is tender here. So Sean has rotation of C2. What we're going to do is we're going to help bring that back to neutral here. Have you relax that right shoulder, wiggle the toes. Beautiful. And then the extension that we're talking about, that's going to go right through here at C5. Good. Relax this left shoulder. We're going to do 3 small ones. 1, 2, last one. Beautiful. And then for a routine adjustment, I typically like to do a little bit of cervical distraction here. Good. And Mr. Sean should be feeling a lot better. If you do like our content, if you want to hear more from me or ask me any questions, please like and subscribe at Real Chiropractic.